So one of the things that I think is really important in understanding how to use your body in yoga is understanding how our body is made. What is our body intended to do? And the other concept that I talk about in my Stay in Your Flow, Don't Get Injured in Yoga course is how to really know what you're supposed to be feeling in a pose and what you're not supposed to be feeling in a pose. Oftentimes we get the cues that say, we should listen to our body, but do we really know what that means? Do we really know what it means to listen to our body? So today I'm going to show you a little bit about a forward fold, which is a very common pose that we do in yoga. And so we have Kristen here who's going to demonstrate a modified mid-range version of what a forward fold would look like. So when we do a forward fold, typically people feel a pull in their hamstring, maybe even a little bit of pull in their glute or their spine if they're tight in that area. So your hamstring runs from your hip down to your knee, and you usually typically feel it in the back of your leg right here. So that's a normal sensation, and that's something that's typical for this pose. Now, a lot of people, once they go deeper into this pose, you can go a little bit deeper, will feel it in the back of their calves and through here. And they oftentimes feel like, oh yeah, I'm getting a good stretch in my hamstring, this is good. Well, one of the things to know about that, when you feel it in the back of your calf, it's actually pulling on your nerve. That sensation, when you feel it in the back of your calf, is actually pulling on your nerve. And I'll ask you, do you think your nerve wants to get pulled on? Probably not. So if you're feeling it in the back of your calf, that's a sign that you need to let up. So go ahead and let up your range of motion a little bit. You can also look up with your head if you're feeling it in your calf, because what you're feeling is a neural tension that goes from your brain all the way down your spinal cord and all the way down to your toes. You can also point your toes if you're feeling it in your calf, and that will take some of the pressure off of that nerve. So remember, your nerves don't like to be pulled on, and if you're feeling it in your calf, it's because it's your nerve. So really discerning, are you feeling it in your hamstring or your calf? Because in this pose, what we're looking for is feeling a stretch in your hamstring. Now, I mentioned earlier that we really want to know and understand how our body works. So, our hip joint is meant to flex, which is basically increasing this angle here. The more that Kristen bends into a forward fold, she's getting more flexion here. And this is useful. It's useful for us going up and down stairs. It's useful for us reaching our toes to put our socks on. It's the way our body is intended to work in that way. But there's a certain point where you don't really need any more flexion. So as you progress in yoga, you may find that when you're in your forward fold and all the way down into your forward fold, you get really flexible, that you can be here and not feel anything. When you get to this point and your stomach is lying on top of your thighs and you don't feel anything in your hamstring, that's enough flexibility. There's no reason to have more flexibility. It does not increase your function. It does not improve your back alignment. In fact, what happens is basically the brakes in your hamstring start to turn off. You're not having the brakes in your car work, and you end up pinching into your hip joint and causing issues in your hip joint. And joint issues are really where a lot of yoga things originate. So you may have your instructor say, put a block on the bottom of your feet and grab onto the block and pull harder. This is not increasing your function. In fact, this is just making your hamstrings more and more flexible and taking some stability out of your hip. So my recommendation would be, I'm going to take this block away from you, if you can get your stomach all the way down onto your thighs, which if you've been doing yoga for a while, you may be able to, that you should be working on in this pose more of your breath, more of moving your prana, more of engaging your core, more of elongating your spine, instead of trying to go deeper into the pose. Deeper is where you're going to get injured. So I hope that provides you with some insight on this pose, and that I hope next time when you practice yoga and you do this pose, you'll be thinking about it a little bit differently.